to Empowerment Resource Center's 10th annual Hats Off to Women extravaganza. Your time is so valuable. Thank you for sharing it with us. I'd like to welcome you to this event. Thank you for your time and tell you that although we are in the midst of the COVID-19 pandemic, we are still observing National Women and Girls HIV and AIDS Awareness Day. Please grab someone you love, hold them close, and let them know that there's still a risk for all of us women. Each one of us should teach one. But as we move forward, and although you can't be with us at this time, 2021 will reveal many new projects and services that ERC is going to roll out. For example, we're starting our Pappy Hour. I'm so excited. Where we will be doing women's pap smears and vaginal exams in the ERC Comprehensive Intervention Clinic. We will also be starting with birth control. So we've always talked about that in our family planning services. Now we'll be offering those services at minimal cost to those clients who are at risk and underserved. So sit back, enjoy the rest of our program, and again, welcome to the 10th annual Empowerment Resource Center Hats Off to Women event. See you soon.
To get us started, I'd like to introduce two of ERC's extremely dynamic employees, Ms. Lauren Elaine, APRN, and Janae Rollins, Outreach Team Lead. HIV continues to be a very serious health issue around the globe. Worldwide, there were about 1.7 million new cases of HIV in 2018 around the world, and about 37.9 million people were living with HIV in 2018 around the globe. And 24.5 million of them were receiving medicines to actually treat their HIV called antiretroviral therapy, or better known as ART. So with today being National Women and Girls HIV Awareness Day, I'd like to switch the focus to women and girls. So Lauren and Janae, what are some of the steps we can take to prevent and educate women and girls?
So thank you, Phyllis. As the advanced practice RN here at ERC, we want to educate women on their options, specifically about condoms, PrEP, PEP, and educational options that can help prevent transmission of HIV.
Wonderful, Lauren. So with some of these new advances, do you think that perhaps when it comes to HIV that women and girls have let their guards down?
No, I don't think so, but I think there's definitely more we can do to step up the process. So meaning, I think what we can do in terms of education is to broaden that. We can have more outreach programs, we can encourage women to go to their health centers, we can have more education online, YouTube tutorials, and specifically in primary care and community-based clinics, we can have our PCPs talk to women about their options.
Oh, wonderful. Absolutely. Thank you very much for that, Lauren. And I'm so glad you mentioned outreach because, Janae, I know that you are the team lead in outreach. So can you possibly talk to us about ways that we would actually contract HIV?
Yes. Contrary to popular belief, there are only 4 ways that you can contract HIV. The first is through blood. Second is through secretions, which is vaginal secretions as well as anal secretions. And then the last is breastfeeding.
Wonderful, absolutely, extremely educational. I think I'm aware of one of those ways, but I would not have imagined the other 3 ways. So thank you so much for that. Lauren, I'm very interested in some of the things that you started to share with us because it sounds like you were starting to also talk a little bit about reducing HIV infections in women and girls. So could you please just add a little more around that topic, please?
Absolutely, Phyllis. So in general, 1 in 8 Americans are infected with HIV and are not aware of that. So And this includes women and young girls, or girls and women as well. So what we can do is offer them now programs and opportunities to prevent transmission of HIV. And when we're talking specifically about physical measures, we're talking about condom use. So condom use during sexual activity is the main way, the cheapest way, the easiest way to prevent transmission of HIV. Now we also have PrEP, which is pre-exposure prophylaxis. It's a drug that you take, or a pill that you take once a day, every day, to prevent HIV transmission. Even if you were to have unprotected intercourse with somebody who is HIV positive with a detectable viral load, this medication is effective up to 98% in preventing HIV transmission. And it has been previously considered a medication for men, specifically gay men, but it's just as effective in women as it is in men.
Okay, fabulous. Thank you so much. Extremely educational. Janae, I know that in your particular department that you specialize in HIV testing. Would you be able to share an experience or story with us around HIV testing, please, so that we all become a little more comfortable with it?
Yes, of course. So like she said, we are in outreach. So we go out into the communities most of the time and provide free HIV testing for people. The way that we kind of just give them a brisk breakdown of the testing. We let them know that the full thing probably takes about 5 minutes. It takes you about 60 seconds to get your results because we do use the Insti Rapid testing. So basically, once we do your paperwork, we just ask a few pieces of information from you. We ask some things about your habits and things like that. Once we do the test, that takes about 60 seconds itself. It's a quick prick of your finger. It's just like if you're going to the doctor and get your blood sugar checked. We get a few drops of blood from you, so no, we don't have to go in your vein or anything like that. We get a few drops of blood from you, and then once we conduct the testing part, you will get your results immediately afterwards.
Okay, wonderful, wonderful. Well, again, with this being National Women and Girls HIV Awareness Today, I'd really like to thank Janae and Lauren for just their knowledge and wealth of expertise that they have shared. So we thank you all for your time today, and also we congratulate you and salute you for all of the wonderful work that all of you are doing in the community. Thank you very much. And next up, we're going to have our Hats Off Award. So please stay tuned.
Hello everyone, my name is Lakeisha Stinson and I am the Clinic Operations Manager here at Empowerment Resource Center. And here at the clinic we offer an array of different services to our clients. The one that I'm always so super excited about is free HIV testing to any client that comes in the door, that you're able to get those results the same day. We offer PrEP, PEP, family planning, counseling, and consultation. We offer STI screenings, treatments, immunizations, and vaccinations. So if you're in the need of some screenings or some counseling, you want to talk to the providers or our lovely staff, please take some time to come and check us out. Thank you so much. Have a great one.
Hello, my name is Sherry Powell and I am Training and Volunteer Coordinator here at ERC. How can you help us volunteering at ERC? You can do it 3 ways. You can donate monetarily, you can donate in-kind goods and services, and you can volunteer with our outreach team. Our outreach team goes to 5 metro Atlanta counties and we're always in need of help. Check out our website at www.erc-inc.org.
My name is Taylor DeLoach-Hogan. I work in the clinic here at ERC as a patient care coordinator. It is my great honor to be awarding Ms. Antonina Foster the Hats Off to Women Award this year. So Antonina has over 10 years experience in women's health and wellness, and she has an extensive background in clinical research. She specializes in perinatology, which is very important. I practice that word, endocrinology, and sexually transmitted diseases, the management and the research. She graduated with a Bachelor's of Science in Nursing from Tuskegee, and she also earned a Master of Science in Public Health from the University of Alabama, as well as a Master of Nursing, and also at the University of Alabama. Miss Nina is focused on health disparities and minorities, and it brings me great joy to award her with this for all her hard work and for being a lovely individual. And we miss you here at the clinic during COVID. Miss Nina, you're the greatest. I wore red lipstick for you because you rock it. You rock. We love you.
Hi, my name is Tanisha Taylor. I am the Director of Programmatic Operations and Empowerment Resource Center. And yes, Taylor, Nina is awesome. Nina, we thank you so very much for all of your time, commitment, and dedication to the mission and vision of Empowerment Resource Center. We would not be who we are without you. We have come to the end of our program, and this year, as stated earlier, marks our 10th annual, and we want to encourage you to share this message with other women. While we know that the pandemic has certainly shifted our priorities and how we come together, the one thing remains is that HIV is still very much an epidemic, and it's important that we know our status and that we're taking advantage of all the education and preventative measures that exist to prevent transmission of HIV in our community. So we hope to see you next year at our 11th annual. If you need us or if you have any questions, please do not hesitate to reach out to us. Thank you and have a great day.